We're about to get into the various health benefits of lower carbohydrate diets, and there do seem to be many reasons why reducing carbohydrates, particularly those simple carbohydrates that don't come with additional nutrients and fiber, are going to be beneficial for you. Do you gain true long-term benefit from doing a short-term, highly restrictive jumpstart like we see in the Atkins or South Beach diet? It doesn't seem so. Instead, taking the general principles from the zone diet of higher protein, healthy fats, and a slight reduction in carbohydrates, focusing on getting your carbs from complex carbohydrates, which we also see in the maintenance phase of Atkins and South Beach, is going to be a better general approach, and it saves you the pain of having to stick with an incredibly restrictive diet for several weeks or months, when the results at 6 months to a year out are going to be pretty similar if you simply follow a more moderate approach. So why put yourself through the pain? If you follow Zone, Atkins, South Beach, or just reduce your intake of simple carbohydrates, you're most likely going to lose some weight, both initially and in the longer term. Basically, if your goal is to lose weight in the 3 to 12 month term, any of these approaches can work, but the results are not going to be much different compared to following a low-fat diet with similar calorie restriction, at least simply for weight loss. But weight is not the full picture of metabolic health, right? There was a really interesting study in 24 men and women with obesity and prediabetes who were provided all of their meals for a 6-month period. And they either consumed the 40% carbohydrate, 30% protein, 30% fat pattern that the zone diet is based on, or a high carbohydrate pattern of 55% carbs, 15% protein, and 30% fat. So the fat was the same in both patterns. The differences were in carbohydrates and protein. And they were reduced by about 500 calories per day from their energy needs to promote 1 to 2 pounds of weight loss per week. So what they found was after 6 months on this calorie-reduced diet, all 12 subjects, 100% of the people in the 40-30-30 group, that pattern that was similar to the zone diet, were no longer classified as pre-diabetic, whereas only a third in the high carb group were no longer classified as pre-diabetic. So both groups lost close to 10% of their body weight, and there was no difference in weight loss between the two groups. They both had significant differences in fat mass as well, but really importantly, the high carb group lost lean mass, so lean muscle mass, and this is not something that we want to see with weight loss. Maintaining lean muscle mass is important for a lot of reasons, and they actually saw an increase in muscle mass in the 40-30-30 higher protein group. The higher protein group also had greater reductions in HbA1c, that measure of long-term glucose levels, and indices of insulin resistance like HOMA-IR and the insulin sensitivity index. They saw greater reductions in triglyceride and LDL cholesterol levels, and greater reductions in inflammatory cytokines like TNF-alpha and IL-6. The way they defined remission of prediabetes in the study was by standard definitions of fasting blood glucose level cutoffs for prediabetes and the 2-hour glucose level following an oral glucose tolerance test, also called an OGTT. In an oral glucose tolerance test, you take a fasting blood sample for blood glucose, and then you give the person a glucose drink with 75 grams of glucose, and you take blood samples every 30 minutes for 2 hours. And while both groups improved their responses to this oral glucose tolerance test after 6 months on the diet, the 40-30-30 higher protein group had greater improvements in this test. In a separate publication about the same study, they showed greater increases in the incretin hormone GLP-1, which stimulates insulin secretion in response to food, and GIP, which inhibits another hormone called glucagon. Now, we don't need to get into the mechanisms, but interest in GLP-1 has exploded since the Ozempic craze because Ozempic and similar drugs work by activating the GLP-1 receptor. This study shows the 40-30-30 macronutrient pattern with weight loss after 6 months. It increased GLP-1 levels after the oral glucose drink, and it increased GLP-1 levels after a test meal compared to the high carbohydrate diet. They also saw decreases after these tests in the hunger hormone called ghrelin, which suggests that higher protein diet would result in less detectable hunger in those subjects, though they didn't measure subjective hunger ratings in this study. So while this study was still small in terms of numbers, it included both men and women. It was actually quite a high percentage African American participants, and it was a well-controlled study where food was provided for 6 months, which is really challenging and expensive to do. To me, this study demonstrates a lot of what we already know, which is for calorie-matched diets, weight loss is going to be pretty comparable, but higher protein diets are better at preserving that lean muscle mass that's important, and it's likely one of the reasons why the higher protein group had better insulin sensitivity and glucose tolerance, because muscle is a major tissue for glucose uptake. Blood pressure and total cholesterol were lower in both groups and were not different between groups, but a few other cardiovascular risk factors like triglycerides and LDL cholesterol were more reduced in the higher protein group, as were those inflammatory cytokines. So this study really highlights some positive benefits for the zone macronutrient distribution of 40% carb, 30% protein, 30% fat, compared to more typical and higher carbohydrate distributions. And really, the good news here is that it's not a huge reduction in carbohydrates. You're really just swapping some simple carbohydrates for more protein, and that's a change I think a lot of people can get on board with. The takeaway from this study and others like it is while weight loss may be comparable on various dietary approaches, that's not all that matters. The metabolic health outcomes like blood pressure, blood lipids, insulin sensitivity, lean mass retention, and the like are actually of greater health impact than simply the number on the scale.